When COVID-19 hit Guyana in March of this year, with the first coronavirus-related death recorded at the Georgetown Public Hospital Corporation, Guyanese were stringently avoiding visiting the hospital. However, in recent weeks, there has been a marked increase in the number of persons accessing the services of the Accident and Emergency Unit. Head of the Accident and Emergency Unit, Dr.Zulfikr Bux, told this newscast that on an average day, approximately 350 persons seek medical assistance at the A&E unit, but only about 150 of those present with illnesses or injury require emergency care and treatment. In the last few weeks, the A&E has been catering to between 120 to 130 patients daily.
When COVID came, I think because of the restriction and people being more restricted with their movements and more caution and a little more discipline with their behaviors, our cases dropped to the point where we were seeing only 40 to 50 patients on a daily basis. Luckily, that gave us time to plan for COVID and adjust our system. So during that period, March, April period, we were only seeing about 50 to 60 patients. Now, I think because everyone has gotten more or less accustomed and understand how things work, we're actually back to about 100 120 emergencies daily.
In an effort to prevent a buildup of patients at that unit amidst the ongoing pandemic, many patients with non-life-threatening ailments are being referred to the outpatient unit of the hospital. Reminding that the GPHC is the country's main referral hospital, the institution is also once again reiterating the need for persons to utilize the health centers and hospitals in their communities for non-emergency medical treatment. One of the observances made by Dr. Bux, which he finds concerning, is that a great number of patients accessing medical attention from the A&E in the last few weeks are those who received injuries within the curfew hours.
What is worrying is quite a bit of them are trauma related, and most of the traumas that are occurring during the curfew time. So what it is showing is that members of the public are not adhering to the curfew as much as they should. They are reckless, getting up, ending up in accidents and having quite a lot of trauma and injuries, and are becoming patients, and that has actually led to an increase in our statistics in terms of patients that are presented to us.
Dr. Bux urged Guyanese to adhere to the guidelines set in place by the National Task Force to keep themselves out of harm's way. This, he says, will lessen the ever-increasing pressure and workload medical professionals have to attend to on a daily basis so that they may be better equipped to deal with the COVID-19 situation.
I'm also urging members of the public to be a bit more responsible with their behavior and try to make our workload as little as they can during this time, because whilst we on a regular basis we will manage patients and we don't have an issue with the numbers that they come, during COVID we have to be a bit more selective, and it takes more time to stratify you according to if you're COVID or not. And when you have a large influx of patients because of persons who are reckless in their behavior or who choose not to adhere to guidelines, it just negatively impacts healthcare workers and also the healthcare system.
For the HGP Nightly News, Amel Griffith.